You've been all over the virus, right? In terms of very early on calling, hey, this is
Right.
going to be bigger than we think. This is going to get out of China. A bunch of things that now we know as fact, but at the time, you were early to see that. Maybe just give us at a 10,000-foot view, like what has transpired since the end of last year to today with the virus, both good and bad, and kind of not only the events that have occurred, but also the responses from various governments.
Well, so it showed up initially in China. Initially, Chinese repressed news and let it get farther than it should have, but then they switched around and did a strong, heroic suppression and managed to keep it suppressed not only in Wuhan where it struck, but prevented it from spreading to the rest of China substantially. A heroic and strong and expensive effort. And the rest of the world didn't sufficiently keep it from leaving China. Unfortunately. And so, the ideal thing would have been if the rest of the world had just locked down, traveling from China and, testing and things like that, then it would have stopped then. And a great many other pandemics have been stopped at that very early stage. And that's overwhelmingly the most cost-effective point at which you want to deal with it, is just to make it stop at the beginning. But many governments failed to stop it from spreading to the other places. Now, some of the initial places that failed, and then, like South Korea, for example, they had an initial problem outside of China, but then they did a heroic, strong effort and managed to suppress it there. And some other places in the area did, pretty strong efforts of grabbing it initially and stopping it, like Hong Kong, Taiwan. But it's a big world. And a key thing to know about a pandemic is when you have any sort of growth process, when you average a bunch of different growth processes, the total really is dominated by the fastest growth process of the set. So that it doesn't that much matter what the median place does, it matters what the worst place does. And when you add up the total, the worst place dominates. At least unless you can sort of isolate them from each other and mean that when one hits a maximum, the other places don't get affected. So, so it's a big world. It's spread around the world. And some places did better than others. But of course, the basic problem is wherever it does worse, that makes a lot of cases. Those people go elsewhere and that spreads. And so that's what we've seen so far, is that even though many places have done very well, the worst places have dominated. And now the US is kind of one of the worst places. We're the guilty party, and not overall in the US, say New York and a few places, they dominated the total effect because, again, it's not about the middle place and how well it does, it's about the worst place and how well it does, how badly it does. And so, initially, public health officials, when they saw it escaped China, they said to themselves, reasonably, I guess that's it. This is going to go most everywhere. And that's what I said. I said, shit. I even said it, I thought, as it seemed to be escaping from Wuhan, so I guess I was a little early. I said, look, it's going outside of Wuhan, that's it. And the rest of China did manage, surprising to me, to keep it down, but then it went to the rest of the world. And so public health people said, that's it. I guess we'll have to deal with this going most everywhere. Public health people have a lot of experience with the diseases, and basically nothing has ever spread that far and then been contained. And so they were perfectly reasonable to expect that that would happen here. But when they've said things like we need to flatten the curve, spread it out so that there's not too much impact at any one moment for the medical system and the rest of our systems, then the elites in the world said, nuh-uh. They said, no, this has to be contained. So they had suddenly woken up and decided that even though initially they screwed up, and so in the United States, the health officials really badly screwed up, CDC, in terms of preventing testing, preventing masks, a whole bunch of things that you can read about, how badly we screwed up for a month there. But then once the elites in the world were concerned about this and talked about the concern, everybody said, no, we can't give up on this, we must contain. And so ever since then, that was, 3 months ago, the elites in the world said we must contain, and they started writing white papers and doing analysis and saying, well, look, some places have contained, South Korea, Taiwan, Hong Kong, and many places have contained. And here we're not doing a good job, but we ought to be able to do a better job, because how could they be better than us? And they listed out, well, we need a lot more testing, and we need a lot more ways to do tests, and we need a lot more tracing, and maybe apps and different, we need to hire more people, and we need more rules about isolation, and we need more masks. And, people went wild talking about all the things they thought we should do, and all the different big things. If we did them, then that should be enough, because, hey, there's other places that are succeeding. But the fact is, we haven't actually gone very far in those directions. For whatever reasons, we haven't. Now, one way to think about this is to say, look, policy is complicated. And it's less about each little piece than having good packages. So different countries in the world just have whole different governance systems and whole different strategies and whole different resources. And I would think if you saw some places are working and other places aren't, and you wanted to win, your best strategy would be to pick the package that works somewhere and just slavishly copy that whole package. I mean, that is how innovation tends to work in the world. If you think, some company like GM is successful and you don't know what about them is successful, you just try to copy the whole cultural package, all the little pieces, and you think you're going to try to be like them. Unfortunately, that's not what people did. They didn't say, let's copy South Korea or let's copy Taiwan or even Wuhan. They said, we here in our different place, we're going to do our package that makes sense to us. And they all different packages, and now they're all in different places. And even today, when we see our package isn't working so well, we aren't tempted to do a radical, let's now go to South Korea package or something. And then even that, it might not be feasible anymore, in the sense that we might be too past an early stage where certain things work at the early stage but don't work later. And so we still got all these people saying, if only you would follow my prophet, we would all succeed, but they're not all behind something. So initially, back in February, March, the elites all got behind this story. We're all going to lock down and we're all going to beat this thing. But they let everybody say, well, you choose your own lockdown, you choose your own style and your own everything. And now if they would all say, no, we need the South Korea package or whatever it is, and all get behind that and say, and here's the budget and we're going to spend a lot and we're just going to do it, we would all probably go along with it and that might work. But we're not. The elites are not like behind one common package. They're spread across a dozen different priorities and what things we should be focused on. And there doesn't seem to be much of a movement to change the overall policy. And after this initial peak, we're going down a bit, but of course the problem is we're not going down very fast. So, I mean, the two key outcomes for a pandemic are it spreads and everybody gets it, everybody gets exposed, or it's contained and squashed down to a low enough level that then the traditional methods of test and trace can keep it down. That still can be expensive, but those are the options. But hanging out in the middle doesn't get you anywhere. And in fact, if you spend a lot to hang out in the middle, you're doing worse than going in either direction.